enjoy. So I'm going to start right off the bat. And so this is again for audience, for public, for patient with melanoma. And, they had a melanoma and they're coming in for skin exams. Most of the time, but they're just really, really anxious when they walk in. What do you say to them? And how do you help them to sort of relieve and reduce the anxiety level?
Well, I think first of all, I congratulate them for being a melanoma survivor, and of course, what that means has a lot to do with what they had initially for their melanoma. And of course, most of the time these days, melanomas are caught at a reasonable stage and easily cured. Most of the anxiety, as you know, Dr. Wang, comes from the fear of the second melanoma, in addition to the fear of that original melanoma recurring.
Exactly.
So the first thing I tell them is when I've been congratulating them on surviving is telling them, but no surprise, because you had good treatment, you had good people taking care of you, and you should do great. And I think it's important for them to follow up with their dermatologist and see their dermatologist on a regular basis, at least for a few years. From the time of the melanoma. It's controversial how often people should be seen. We usually see people every 6 months for the first 5 years, and then maybe we'll see them annually after that. But I also point out to them, look, you had this melanoma, and this life remains worth living, and you should enjoy it. And so put things in perspective. Life is short, and you got to really take advantage of it. So from there, we often will talk about what expectations should be in terms of melanoma reduction of risk mitigation. And so we talk about relative risks. The relative risk, as you know, Dr. Wang, of getting a breast cancer for a woman is 1 out of 7. It's quite shocking when you think about it, but then you think about it a little bit further, and yeah, that's absolutely right. And so the relative risk of a melanoma for a Caucasian living in North America who has not had a prior melanoma is probably 1 out of 40 lifetime risk, although we don't know how real that number is. I don't know if you're going to get into the controversies about overdiagnosis of melanoma and melanoma in situ and what
we will get to it. Yeah.
But there are lots of risks, and you mitigate them. So in the case of breast cancer, you follow the American Cancer Association and other organizations, the American College of Physicians recommendations, the American College of Family Practice recommendations on screening. And